Department of Hospital Administration, AIMS Nagpur, right, sir?
Yes.
And our colleagues from the other AIMS also, who are the nodal officers as well as the, those officials who are engaged in this patient safety as a part of this, ongoing this patient safety programs, which we are trying to implement across the country, right? So it is, I would say that today's, this webinar, the topic is on this electronic health records and this patient safety. We all are aware of, this 70 into 5, this actionable framework on the patient safety. And that there is one pillar is there, and that is on the information research and the risk management. And that there's digital technology for patient safety is there. I think this is very much aptly into that. No? And digital health also is also the focus of the ministry also. And not only that, the program, in order to imbibe such focus areas, in order to improve the quality, obviously safety, the component into this program, patient safety. And I think that all the other, our colleagues in the premier institutes must also be, they must have already been undertaken some of the actions also. And some ongoing options, distant actions must also be there and be proposed and all. And if you also, engaged a little actively, in today's, while after the experts, these presentations, not only in the queries also, but also what it has been doing in your areas also, in your institute also. If that has, if these are also shared, I think we can bring out one proper some sort of action plans under the patient safety program under the ministry. So I would like to, I will not take much this time. I would straight over hand over to Dr. Nitin to share us your perspectives and on your experiences on this today's topic, so that others also can in this today's time, all are busy, so let us make it valuable time for all of us. Thank you, Dr. Nitin. Kindly, you may take over.
Thank you, Dr. Rameshwar, sir, CMO Patient Safety Secretariat. I welcome all the participants who have joined for today's webinar, and I want to thank DGHS for giving me an opportunity to speak on this topic. Let us start the presentation. I think almost most of them have joined. So we'll be discussing today the electronic health record and its role in patient safety. So next slide, please, Adesh. So I would like to start and begin my session with some important questions. Can electronic health records actually improve patient safety? There are proponents who say that EHR are actually critical for improving patient safety because the electronic health records are easily accessible. We can provide better care with free of medical errors. Where there are critics also who say that what happens if there are system failures or errors which take place in case of improper implementation, and especially the challenges that we face in transition from the paper-based records to the electronic health records. So the questions for today's sessions, and we'll just try to find the answers in my session. So how do actually EHR address the patient safety risk? And are there potential risks with the electronic health records adoption itself? And what are the key benefits and challenges? So we'll explore all these questions and answers to this. Next slide, please. So this is just a brief outline of what I'm going to talk about today. We'll just start with just introduction, what exactly are EHR, what are its components, and what is the interlinkage between the electronic health records and the patient safety. How the electronic health records actually are enhancing patient safety. Then we'll also look at some of the challenges in the EHR usability and patient safety. So we'll just correlate with one of the case scenario that how the EHR gaps can impact the patient safety, and if it is implemented properly, how we can improve the patient safety aspects. I'll also like to discuss some components of the ABDM mission which is there and how it is relevant to patient safety presently in our country. We'll also see the challenges and gap in the current EHR in the country, and how the ABDM ecosystem is actually going to solve all these challenges. So we'll just go through how exactly anyone, we are working in various capacities in various hospitals. So how exactly we will be able to implement the patient safety through electronic health records. We'll also see the strategies for adapting the EHR for the patient safety in respective organizations, and the current need for research that is required so that the EHR and patient safety aspects are taken care. So, just next slide. So basically, starting with the introduction, actually the electronic health records are the digital system that are used to store patients' medical information that includes medical history, diagnosis, medications, test results, and treatment plans. So some of its components include the clinical data repository, clinical decision support systems, computerized provider order entry, and physician documentation. So basically, electronic health records facilitate real-time, patient-centered, and data-driven care. So we can, what is the linkage between EHR and the patient safety? There is a direct linkage. It improves patient safety by providing more accurate and accessible and coordinated care. The core benefits include the medication safety, the diagnosis is more accurate, the communication is streamlined during the transition and the handover takeover. However, there are it introduces new challenges also that can impact patient safety if it is not implemented properly in the organizations. So let us look at how actually the EHR enhance the patient safety. Uh, EHRs actually improve access to comprehensive health information. It provides real-time access to critical data. Next slide, please. Next slide. Next slide. Yeah. Yeah. Thank you. Uh, EHR enhanced patient safety by improved access to comprehensive patient information. So there is a real-time access to most of the critical patient data. It provides accurate and complete information that helps the clinicians to make informed and timely decisions. And this is somehow it avoids errors. The clinical decision support system helps in preventive care reminders, ensures timely reminders for screening, vaccination, and various other preventive services. The diagnostic support with the CDSS helps reducing in diagnostic errors, and it helps in guiding the clinicians and also helps in evidence-based protocols. So EHR also help in patient safety analytics. EHR data helps to identify the trends or the adverse events to inform the quality improvement that is required in the organization. It also helps for the predictive analysis to predict high risk patients, enabling early intervention and prevention of complications. Uh, it also helps in reduction of medication errors, especially the e-prescription and the alerts. It minimizes the errors due to illegible handwriting and automatically alerts for drug interactions. So it helps in enhanced coordination of care because of the interoperability. So it facilitates the data exchange across providers. So the patient who has been treated at one hospital, and if he goes to other hospital, they'll be able to access his records because of the longitudinal health records. You will be able to access the records because of the interoperability. Then the patient engagements, usually the HR enhance the patient portal provides access to health data, helpful in shared decision making, encourages informed patient participation, and overall safety of care through better communication. So let us next Avdesh ji, next. So previous slide. So let us look at some of the challenges in the EHR usability and the patient safety. If you look at some of the challenges, this is poor usability of the EHRs because of the complex interfaces and the inefficient workflows that can actually hinder the clinician's productivity. There might be distracting alerts and notifications that reduce the decision-making efficiency. There are also quality control gaps. Hospital often overlook regular safety testing for the EHR systems. We usually assume that EHRs are already safe. So there are a lot of quality control gaps. Then there's a lot of data fragmentation which is there. Lack of interoperability actually hampers seamless data sharing of patient information. So this can lead to incomplete records and unsafe care decisions. There are also cost and resource barriers because of the high cost. The smaller hospitals are not able to adapt the EHR systems. If you look at the linkage between the usability and safety, difficult to use system actually perform poorly. There is a reduced ability to catch harmful medical errors like drug interaction, allergies, or dosing issues. There is actually need for collaborative improvement. So there needs to be collaboration between the EHR vendors, hospitals, and clinicians is necessary, because the focus should be on optimizing usability and integrating the safety measures when you are getting into the EHR of your organization. So over reliance on automation, most of the clinician may depend too much on the automated system, sometimes overlooking the critical judgment calls. So there might be user dissatisfaction because of some negative experiences with the EHR that may lead to burnout and reduce focus on the patient care. There are also challenges wherein there is lack of standardization, so no universal standards for EHR usability or safety performance. Customization by the hospitals can compromise the system integrity and safety sometimes. There are also challenges with the alert fatigue. So there are a lot of alerts we get distracted. In fact, there are various studies which show that excessive and irrelevant alert actually desensitize the clinicians, leading to missed critical notifications. There are also challenges where there are inadequate trainings related to EHR. So limited training actually causes more errors, especially during the transitions. So there are also issues with the privacy, security risk, and cyber security. So vulnerabilities in EHR can actually lead to data breaches. There are laws pertinent to it, but still these things can happen. Next. So let us understand this by a case scenario, that how exactly the EHR gaps can cause safety concerns. So there's a case scenario, just a hypothetical case scenario. There's this 45-year-old male patient is scheduled for elective gallbladder surgery due to chronic gallstones. The patient has heart disease which is not updated in the EHR. Next. So we'll look at various aspects of how what happens in the pre-operative review, and what happens, what is the communication gap, what are the risks, what is the decision-making capacity, how it happens, and overall how it impacts the patient safety outcome. So the organization might be having a transition from the paper-based to the electronic health records. The surgeon reviews the old record, which does not include a actually updated heart disease. So due to this, there is inadequate preparation for the potential cardiac risk that is there during the surgery. So there's a miscommunication because the heart disease update has been sent via paper record, which was not integrated in the EHR in time, so leading to delay in the surgeon receiving the full clinical picture. So there was no alert or flag for cardiac concerns in the EHR, so the surgeon is unaware. So this hampers the decision making, leading to proceeding for the surgery without adjusting the plan for the cardiac risk, and there might be chances of intraoperative complications that the patient might face. So overall, if you can see the patient safety impact, the patient is at a higher risk of complications due to missing critical information. Next. So suppose if the EHR is implemented properly, the heart condition is actually updated, the real-time EHR will help the surgeon to locate that, okay, the patient has a heart condition, and the alert flags notify the critical condition, and accordingly the surgeon adjusts the treatment plans. So the patient who undergoes surgery with timely preoperative testing and adequate risk management. So the outcome is better patient safety in these aspects. So next. So let us look at how the Ayushman Bharat digital mission actually, when the government launched it, it wanted to create a whole digital healthcare ecosystem. We'll just look at how it is actually having its relevance to patient safety aspect. It has already incorporated a lot of things that we discuss pertinent to patient safety. Firstly, with the unique health ID, I mean, it ensures accurate identification of patient, which is one of the aspect of patient safety of identifying the patients correctly. Then they have the health professional registry, which provides access to verified health professionals. So it actually reduces the risk associated with unqualified practitioners. So the health facilities registry is also one of the feature of the ABDM, which helps the patient choose actually the certified facilities, ensuring that the quality healthcare services are reducing the risk of substandard care. There are also personal health records, which empowers the patient to access and share their healthcare data securely, thus preventing errors of incomplete or missing medical history during the treatment. So ABDM also has the feature of interoperability, which is one of the core system for sharing of medical records. So if you see that fast health care interoperability resources, which is actually important because if it is not there, there might be fragmented records. So you might be having one record in one hospital. So if he goes to other hospital, he may not be able to access those records. So the interoperability is one of the core issues which will help for access the patient information in whichever hospital he goes, whether be it a government sector or be it a private sector, when the interoperability or the HMIS is compliant with ABDM. So it also talks about the health information exchange consent manager, where the user's consent for health sharing data is there, which ensures that their data is secure and it is authorized by the concerned patient. So this actually prevents unauthorized access and promotes safe data usage for this. So the ABDM is also within the national health stack. So national health stack is the digital health infrastructure which ensures reliable and real-time access to critical patient information. So this will help us in informed quick decisions because we'll be able to access the information in real time. So there's a digital consent work frame that I was already talking about. So only authorized access is given to sensitive data. Therefore, it helps to prevent misuse. Also, the eSanjeevani telemedicine services which are there, which has all these features, helps us in enhancing the patient safety, especially in the remote and the underserved areas. ABDM also has the National Health Claim Exchange. Actually, how this helps in patient safety is it reduces actually the administrative delays. We see a lot of delays in claim approvals, pre-auth approvals. So it could impact the timely treatment and patient outcome. So with this, with National Health Claim Exchange, with ABDM, I think it could definitely have timely treatment and better patient outcomes with the patient safety aspects. So there's a focus on data privacy and security, as I was telling, and the public-private sector partnership, which is there. We just need the ABDM compliant HMIS, be it a public or a private sector, wherever the HMIS is there. So next. So let us look at some of the challenges that are there in the current EHR in our country and the patient safety scenario, and how the ABDM ecosystem is addressing it. I have already covered the how it does. We'll just see at some of the challenges. There is lower EHR adoption rates, especially in the smaller healthcare facilities and in the rural areas due to high cost and lack of infrastructure. So ABDM is promoting a standardized cost-effective system with incentives such as digital health incentive schemes for public and private sector to adopt the digital health tools. So there's also a lot of data fragmentation. So especially the private facilities, making the continuity of care actually difficult. But with the ABDM's health information exchange and consent manager, it ensures seamless sharing of data, as I was just speaking the previous slide. So the lack of interoperability, most of the EHRs in India are incompatible, resulting in fragmentation of data. So ABDM has established the unified framework, which will help for effective communication. So it actually enhances the patient safety. There's poor usability because most of the EHR we see that adapted are not very user friendly. So most of them are not using it accordingly in most of the private and the small, especially the smaller healthcare facilities are there is a low adoption rate for this. So ABDM actually encourages the user-centric design principles in digital health solutions and offers capacity building program for healthcare professionals. There are also cost barriers, especially for the smaller facilities to adopt this. So ABDM is actually trying to foster the public-private partnership model, thereby reducing the cost of this. So there's inadequate training which is there. So that is one of the factor for the low adoption. So ABDM initiative actually is trying to improve the digital literacy and it is improving the EHR usability. There are also cybersecurity and privacy concerns which are there, which are few of the challenges. But since ABDM mandates compliance with the data protection bills, so it uses encryption for secure data exchange. So there's also a lot of resistance to change from a lot of doctors we see even in various organizations, including AIMS also, that they still prefer paper-based system due to familiarity and perceived. Usually they have this fixed notion that EHR is actually cumbersome to use. But what I feel is like instead of writing, we are more we are more comfortable in typing nowadays. So what the ABDM advocates is it advocates the phased approach, starting with basic digital tools such as they'll start with the health ID and gradually expand the EHR adoption. So this is actually helping the smooth transition. That is what almost all the aims have followed this, and I think it is this resistance to change has to somewhere stop, because once we start using it, we find it more user friendly. Alert fatigue is one of the problems that is usually faced. So AVDM is actually he envisions that there are integrating AI driven tools and also decision support features to reduce the manual efforts. So there's also problem with the limited infrastructure, but I think government is working on that. But especially the what the ABDM has done is they have improvements where they provide mobile first solutions, especially for the low resource settings, because a lot of people use mobile than actual desktop. So the applications are designed like that, so there is better adaptability for this. Next. So let us look at how we can implement the patient safety through the electronic health records in the hospital. So starting with the aspects of standardization and interoperability are the most important things in any organization wherever the electronic health records are there. So the guidelines include NDHM, which is National Digital Health Mission, which promotes interoperable data formats like the first healthcare interoperability resources. So any organization should try to adapt the FHIR compliant system so that they're able to share data, and that should be integrated with the national health stack. So if you look at this, if you adopt this, the standardization and interoperability like FHIR, it ensures comprehensive patient records are there, which reduces actually the data fragmentation and actually minimizes the errors. So wherever the patient goes, they'll be able to access his records. So, considering the data privacy and security, again, the guidelines include the EHR standards. It ensures that there is encryption, multi-factor authentication, and as I was talking about the consent management. So, overall, it protects the patient data from the unauthorized access and the breaches. So the clinical decision support alerts, again the guidelines, even the NABH digital health standards promote the clinical decision support systems. Especially, it can help us to implement the drug interaction alerts and guidelines-based recommendation within the EHR. So basically, it will help us to reduce the medication errors. Next. The training and usability, I think this is one of the key aspects. So we need to conduct regular trainings and ensure that there are user-friendly interfaces for the EHR system. So once we have user-friendly interfaces, I think it reduces most of the errors and it ensures that your EHR system is effectively used for that. So, considering the patient engagement and the access, AVDM actually promotes the personal health records and patient access to health data. So, it provides secure access as we were already talking. So, the impact regarding the patient safety is it enhances the patient engagements and actually prevents the errors due to inaccurate data. So the next would be incident reporting and the continuous quality improvements. Almost all the accreditation agencies actually mandate the incident reporting system for the patient safety. So integrating the incident reporting feature within the EHR for real-time patient safety tracking is what is needed. So this will actually help to identify and resolve system vulnerabilities and promptly improve the patient safety aspect in your organization. So these are some of the components of how the EHR can be, how the patient safety can be implemented through the EHR. Next. Let us look at some of the strategies for optimizing the EHR for patient safety. Well, as I just was telling in the previous slide about regular trainings for the clinicians. It ensures that the most of the clinicians are trained for accurate data entry. So the impact would be regular training would actually improve the clinical workflow and reduce human errors in the patient data management. So customization of alert, as I already told that there is alert fatigue, which causes patient safety. They might miss actually the critical warnings. So there should be some customized alert which can increase the clinicians' responsiveness to this. So this will actually help the patient safety outcome. So data validation and quality checks are important to ensure accurate, complete, and up-to-date data which is necessary. So other important thing is about the downtime protocols. We should have downtime protocols and system backups to ensure that there is continuity of care without any disruptions. So we should have written down procedures for what is done in case of downtimes with this. So improving interoperability standards, this I've already spoken, that how we can strengthen the collaboration between the EHR vendors so that to improve the data exchange and the interoperability. So overall, there can be better coordinated care and better clinical outcomes. So patient engagement is one of the important thing where you encourage patients to access their health data and provide feedback to identify potential errors or the discrepancies. So this will patient reported inaccuracies actually involve patients in their care to enhance the data accuracy. So this will ensure that the EHR reflects the true health information of the patient. Next. So if you look at the research needs that are required in EHR for the patient safety aspects, to enhance the usability, designing the EHRs that can reduce the clinician's workload and minimize errors are some of the areas for research. There's also interoperability standards, so developing global and national frameworks for seamless data sharing is what is required. There's artificial intelligence and decision support, exploring AI to predict the risk and improve clinical decision making. Also, patient-centric designs which are needed in EHR. So there should also be a lot of longitudinal studies, which we find very minimal studies currently in our country. So there has to be longitudinal studies measuring the long-term impact of electronic health records on patient safety outcomes. They also data security. A lot of research is needed on blockchain or other advanced technologies for actually safeguarding the health data. Next. Next. So just to conclude my presentation, just a summary of some points. Actually, electronic health records improve patient safety. If you look at from the point of view, it improves medication management. There is better care coordination, and there is actually the proactive health monitoring. So there are certain challenges such as alert fatigues, data overload that needs to be addressed to ensure that the electronic health record system are fully effective in enhancing the patient safety. Considering the Ayushman Bharat digital missions AVDM ecosystem has the potential to create more integrated, safe, and accessible healthcare system in the country presently. So the considering the research aspects into the AI, cyber security, and usability improvement is actually essential to fully optimize the EHR from the patient safety aspects. So the action points would be invest in digital infrastructure, training, and research should focus on more usability improvement, cyber security. And for the healthcare providers, we should actually engage with digital tools to reduce errors and improve the overall patient safety outcome. Next. Thank you.
Thank you very much, Dr. Nitin. I think a lot of things are covered here. The positives are also there. The challenges are also here, visible. The requirement for the the research needs also, and I think that could be done by almost all the institutes, in their
Yes.
own what to say, in these areas.
Yes.
That area could they could also do. It is not that if we have to yes, obviously digitally, we know that in the health sector, while introducing any of this any digital approach, no, obviously we are very much familiar to the paperwork that, as you said. So there is also a resistance is there. Not only that, the issues are that, as you rightly pointed out about the this, because these are new things, no. So people obviously do that, no, do the resistance and do that also. We need a guideline, as you said. The training is also required. Not much time, because time is also another factor. The physicians, they have to record and all. I think this is quite well, this captured here. I think our the nodal officers who are implementing the measures, particularly on today's topic, if they think also, I think it must be there already. I think I believe that it must be already, and they must be aware of that also. And if that also could be shared here, and some questions are being shared also here, Dr.
Yes.
Nathan, we can just what to say, share among ourselves.
Well, sir, as you rightly said, because of the increased patient footfalls, especially in the public hospitals, and the kind of patient load that we
Right,
cater to, so the each adoption by the clinicians is actually there's a lot of resistance, especially with the OPD. It has been implemented, but I think IPD is one area that we need to
yeah,
target.
right.
Yes.
Some focus we could start now from somewhere, from some areas now, which we could do, and then we can what to say, take over the other areas now, as it
Yes.
is advanced now, as it is familiar basically. Because many people are not familiar. I mean, many people are so busy, and so they don't want to do. They don't want to sip into that. No, that becomes very it becomes a burden to them, more burden to them, instead of helping that.
Yes.
So there is some Amol Joshi is asking, I think, three questions here. What he says is that he is from Government Medical College Hospital. Yeah, this is Shavaji Nagar, Aurangabad, no? And
Yes.
his question is about the convergence, no? And a newborn baby born to mother is recorded is in SNCU software, immunization records in different software, follow up in manual records, and data is not retrievable. Retrievable. Different SMS suspected in state government medical college Maharashtra. How to avoid duplications of data? All right. And
Yes.
what he asks about another is that any patient risk registry in the registry in MOHFW, and the third is any patient safety indicators included in the EHR. These are three that he shared some of the questions that,
Yes.
and I think many of them asked also about EHR itself, the topic, the full form of the topic itself also. So, I mean, it means that no, uh, EHR, it must be implemented, but I think a little not by the term itself may not be aware of that, but
Yes.
they
Yeah.
may be aware that this already implemented there.
So
But ministry,
sir.
tell you,
Considering the duplication of the data that is there, I think the interoperability aspects of the ABDM component. So, be it a private sector, be it a public sector, now it's mandated that whatever HMIS you're buying has to be a ABDM compliant HMIS, so that there is interoperability option, and wherever the patient goes, whether he's going to a private setup or a government setup, you will be able to access his healthcare records. So I think that is one aspect where it can reduce these things. So uh, overall, most of the questions, considering indicators that the patient safety aspects and the EHR. I mean, it depends on if you can implement a proper incident reporting system, which can be incorporated in the EHR, can help you out with a lot of patient safety indicators itself when you're monitoring. So it is important that how you integrate these in your respective areas wherever you're working, because the EHR might be implemented differently in your setup and differently in my setup. So we need to see that what exactly kind of indicators that you're catering to or your system can cater to, so that accordingly those indicators can be integrated in your system, and that's how you can get the data on real time basis.
yes, there are also certain, these patient safety indicators which are, so there, and that could also be taken part of that. And one more thing is that what they're asking is that has any AM successfully, implemented this EHR? If not, at what stage? I think some of the AMs must have already this one already. AMs Delhi has already. We have seen some of that,
Yes.
and but I think the concerned, the institute may reply better. No, that which because you know better in your own institute which one is which has been whether this is implemented or at what level it is. Then that I think the concern I think AMs, we are not that aware of that. We are just bringing up this one. But I think the concern, if you could answer, the nodal officers from the AMs now, if you could answer this one, I think that would be good.
Yes.
I have already asked this part: is whether this is established in your institute or I mean at what level that has been done.
Yes, I think most of the aims have established in the OPD, because whatever I could see that a lot of aims are using the CDAC HMIS system, so which has already all these features which we discussed just now. So
Hmm.
CVDM compliant and a lot of features are already there, and a problem is with the IPD electronic health records which is there, but rest all things I think are in place in most of the aims, where especially problem occurs when there's a lot of footfalls in some general specialty departments, and some doctors deter to make entries in the
Yeah,
electronic
yeah.
form there, and then they still prefer the like the writing on a sheet of OPD paper. So that is one of the issues because of the increased workload. So we don't have any data entry operators to help or do that or something like that. But I think CDAC is working on this speech to text things also, which will actually help these doctors where there is a lot of workload like this.
Yeah, Delhi AMs they have replied that view models are implemented, not fully implemented yet. But I still believe that because being AIMS tertiary level, one of the premier institute, what we would believe is that and is that. So we should take up. I think we should try to absorb and imbibe such let's say these guidelines and the we can take more benefits and the positives from these tools basically.
Yes.
This is also one of the that we know that the challenges are there, but that has to be taken over basically. So that is what I feel is that. And some questions are also NDHM. I think that is being already, you have explained. NABH. NABH is more of the hospital, this one, quality related only. And asking. And what another is that we need hard copy of patient safety guideline. Okay, okay. Cloud data. And one more is being asked by Sabu Augustine is that if what if the cloud data gets corrupted, whom we lost all the data? In natural calamities when our network might not work, will this cloud data be accessible?
Yeah, and always the cloud data is going to have a backup, but definitely these are some of the challenges that or apprehensions that everyone has when we are talking of data or the system failures. So these are the issues, and we actually come across this, especially when the systems are down, especially the peak hours. So it is a problem. So
Right. Obviously, change requires a lot of this. We have it has to be in a continuous staircase. The quality continuous quality improvement manner. We have to start somewhere. We can expand if it is if it is benefited, and we also we need to monitor that. That with the help of the indicators and all. And if any challenges arise, we can work together. Then I feel that more positives and benefits are in this EHR. I feel that. I think Dr. Nitin will sum up that part, and we will wind up.
yes.
Okay,
I think the ABDM, sir, I think it is going to resolve a lot of things, and being in future, I think almost every private sector are also uh, getting into this loop of unique health ID that is there, and the availability of the longitudinal health records. So it is actually going to overall boost the patient safety aspects, because you will be able to access the healthcare records of the patient. So I think in the coming days, maybe in a decade, the things are going to change, and overall, because of I don't say that we are adopting rapidly the electronic health records, but it is somewhere picking up. Almost all the government setups now are advocating that we should have the digitized health records. Most of them have started scanning the previous paper records also, so to ensure that you don't miss any continuity of care that is required. So this transition of from the paper and the electronic digital health records is what is needed. So these are some of the challenges, I think, with the government's initiative. I think with the patient safety secretariat also taking a lot of efforts with this, it is going to improve in coming days.
right. Dr. Archana, is the are these recordings will be available to the our nodal officers and all those who are participating here?
Yes, sir.
Yeah, one of them is
Yes,
asking.
sir. These recordings are saved, and we are in process of making a YouTube channel
Right.
where we will be putting all the recordings for them.
Yes, yes. I think that will be good because others they will also again they can listen again and they can refer again. Thank you very much, Dr. Nitin Marathe.
Yeah, thank you, sir. Thank you, everyone. Thank you, all the participants. Thank you.
Yeah, thank you to all the participants also from across the institutes. We will wind up here today. Okay, right?